should be able to hear me now, right? Yeah.
Yes.
Okay. Hopefully no interruption. All right. So we know in 2010, this published study about tattoo using picosecond laser, but at that time the machine is really too big to accommodate daily use in clinics. Okay? And so only recent years that we have a smaller version of the picosecond lasers. And this is when I first got it, picosecond laser, I think it was maybe about 6 years ago. And one of our drug company manager who liked to try it, so I just used a very low setting, and just 1 month after one treatment and 2 months after one treatment, you see that the tattoo has really lightened significantly, right? Compared to Q switch, I find it's not as fast as this picosecond laser. But pigment, the black tattoos we know is very easy always, but what about the color tattoos? Example, this one of my staff's husband, he had a tattoo, a color tattoo, and also a black tattoo on his left finger. So I did a different setting, I split the tattoo into half. On the right side, right side, I did using a pico, and on the left side, I used different parameters, different wavelengths of picosecond laser also. And because I want to know whether just using 1064 is good enough, or I need to change to a Ruby, a 660 picosecond laser. Right?
This slide shows introduction. I think most of people want the eternal beauty. The dermatologic surgery has a rapid growth. Dermatologic surgery have now expanded to the laser treatment, nail treatment, hair transplantation, the ablation, and various skin rejuvenation techniques. This slide shows that the important things we have to do before treatment. I think the important things are these 3 things. Firstly, we need to make a precise diagnosis. Secondly, we confirm the treatment area. Finally, we need to select the best treatment method. To do so, we need to know the characteristics of the treatment. For making a precise diagnosis, inspection is the most important. When malignant tumor is expected and/or we are not able to make a precise diagnosis, we usually use dermoscope and do skin biopsy. This slide shows misdiagnosis of lenticular malignant melanoma after laser treatment. This is a very serious issue. But RF is not directly to melanocyte or melanocyte.
Yes, correct. It is not. There's no chromophore there, right? Because it's not a laser, so it doesn't work using this targeted to the specific chromophore. Correct. To me, if it works, it may be because it is stimulating some fibroblasts and collagen there.
Yeah.
So Andrea asks about what is the best laser overall for melasma. I think we have been, going round and round about this topic, right? About the best laser. The short answer is there's no best laser for melasma. We are still looking for it. Even now, like I told you, I'm still testing out new lasers for melasma. Unfortunately, there's no one good laser for melasma. no matter how expensive it is, and you know, you hear a lot of presentation, industry sponsored, telling you that, oh, this is the best. You combine this with this different handpiece or whatever, this setting, that setting, you know. But like I first said in the beginning, I think it's a spectrum of disease. It depends on how badly damaged the skin is, you know, because all this we know is a photo damaged skin also. So the more severe is damage, of course, the more difficult it is to treat, the more resistant, the higher chances of recurrence in this melasma, as compared to those very mild form of melasma, recently got burned and everything. It's very easy to recover. So there's definitely no one laser that fits all. So David asks again, improving collagen to lighten melasma. Do you think inducing LIOB using pico fractional helps? So that is why the reason why I did that study was because of that. So I did half the face on top of the pico toning. I toned every whole face with pico toning, but on top of that, I used the fractional handpiece on one side to create this LIOB thing. But somehow it didn't show significant difference compared to the other side.